Hi, I'm Renee Oelkers.
And I'm Rachel Salzer.
We are going to be going over the casein-free diet today. What that is, casein is a main protein that is found in dairy products. So a casein-free diet, you would be eliminating all foods that contain casein. Some examples of that are milk, yogurt, and cheese. Basically everything that is considered a dairy product, you would have to eliminate it because it is the main protein that's found in all dairy products. So who would casein-free diets be used for? Currently, the general population believes that it is beneficial for children who have autism spectrum disorder and in regards to their management. So any parents of children with autism could ask you about this in the clinic this summer, and so this will provide further information on that subject. It is often combined with a gluten-free diet. So you'll often see a casein-free and gluten-free diet for children with autism spectrum disorder. So gluten is another protein, but that one's found in the cereal grains. So wheat, rye, or barley, some examples. That'd be an elimination of any breads, pastas, or cereals. And so if a child were on this diet, then they would have to avoid all dairy products as well as all wheat-based products. So that would limit their food consumption drastically because those are two major food groups in today's society. And so there was one study that actually looked at the nutritional impact of a gluten-free and casein-free diet in children with autism spectrum disorder. This was a very large study that was done in Spain. It had 272 children. It was a case control design. And so what they did is they divided children up into two groups. So one group that was an autism spectrum disorder that was on the gluten-free and casein-free diet, and then the other group was just a regular diet. And then the results of this showed that there was nutrition deficiencies in both groups, and that will be coming up later on. But for the most part, the gluten-free and casein-free diet, they had a lower BMI and total energy intake as well as calcium intake compared to their peers on a regular diet. And then the calcium intake of these children failed to meet current recommendations, but there was no difference in their healthy eating index. So what that means is their healthy eating index, that's just that's a number that shows that if they are following recommendations or not. So both groups ended up not meeting current recommendations by FDA guidelines. And so overall, there's no difference for children with autism in their nutrient deficiencies, whether they're on a regular diet or a gluten-free or casein-free diet. So a gluten-free, casein-free diet, what are the effects of it? So in the study, they talked about some proposed benefits. So currently, the society thinks that there's an improvement in behavior on children with a gluten-free and casein-free diet. That was not found in this study. That is just what current popular belief is. And so what they did find in this study, though, is that there was a higher intake of fiber and vitamin K for people who were on a gluten-free and casein-free diet. And there was an greater intake of polyunsaturated fatty acids and monounsaturated fatty acids, and a better ratio lipid profile, as well as a lower intake of saturated fatty acids, as well as sodium. And so those are big things that are considered unhealthy. And so overall, there was better intake of those nutrients on a gluten-free and casein-free diet. But there were some side effects with it. So there was some nutrient deficiencies. There was vitamin D, calcium, vitamin A, pentathoic acid, biotin, phosphorus, and iodine. And one of the major concerns was the calcium and vitamin D because that can contribute to growing rates in children. So that would increase their bone mineral density and increase their length of bones. So overall, with these nutrient deficiencies, that would be a big red flag for children because they're not meeting those growing standards.
Okay, so just for more overall behavioral kind of effects that are happening with your children on the casein-free and gluten-free diets, effective treatments just for any core symptom of ASD are lacking. but the systematic review of 6 random control trials found that there were no statistically significant differences in the core symptoms on standardized scales. A couple individual trials found, one trial found significant improvements in communication, one found it in social interactions, and another found significant improvements in communication, autistic traits, and social contact. But overall, when you take all of the information from these 214 participants, there was no statistical significance in all of the differences. Popular opinion is that a casein-free diet could help with some of the behavioral side effects of ASD. However, it is not routinely recommended by physicians, but it is used commonly by parents for treatment of children with ASD. There is very little evidence that following a casein-free diet is actually beneficial for managing these core symptoms of ASD in children and adolescents. So, recommendations. Unless you have an allergy to casein, there is no consistent evidence to support the use of a casein-free diet in children with ASD. We would actually recommend consulting your child's physician as well as a licensed dietitian for education regarding the casein-free diet and to help tailor a diet to your child's individual health needs and taste preferences. These are our references, and thank you.